Oh, that was great. My task is to set you up for the rest of the morning on the UCL. So I'm going to talk about UCL injury epidemic, the causes, and prevention. And I think it helps to know just a little bit about my journey and how that's sort of allowed me to think about this and have the many wonderful people we have in this room teach us more about how to manage this injury. These are my disclosures, which are updated regularly at the American Academy of Orthopedic Surgery website. So starting on the left, we began taking care of the White Sox in 2003 and 2005. We won the World Series. In 2010, I talked about it yesterday, we were called to take care of Jake Peavy and elevated some of the work we were doing, and we're getting more involved in baseball. And I was asked to be part of the Major League Baseball Research Committee. And I immediately talked to one of our second-year residents, Brandon Erickson, and said, "Hey, Brandon, are you interested in doing some of this stuff?" And he said yes, and Pete Chalmers was there, and he wanted to get involved too. And we started working with Major League Baseball and the HITS database, and I believe we're well over 50 publications since that time. So it's been a tremendous resource for us and for others. And obviously Chris Ahmad, Chris Camp, and others have used this in ways that have really helped us be more evidence-based in the way we care for our athletes. In 2015, we moved on to some other things, and we developed the Pitch Smart program, and that was based on the fact that we saw what seemed to be an increasing incidence of these UCL problems in our kids. And it was really amazing how much, and Dr. Andrews was a big part of that. And then Chris and I started this meeting in 2016, and we started at the commissioner's office at the original location. The book that we put out a few years later sort of summarizes that. I was president of the American Shoulder and Elbow Surgeons in 17-18, and we had a lot of baseball-related activities that year. And then Brandon and I have a book out on sports-related elbow that has a lot of things we're talking about this morning. And we've continued with this baseball sports medicine meeting, and I'm always amazed at how much I learn every time I'm here. And I'm really pleased to have the opportunity to work with Chris over these years and thank him for everything he's done, but also the many other faculty. I mean, just the examination we had this morning of the elbow, I picked up a couple of new tricks that I will use in my care of patients. It's really been valuable. So it just sparks an incredible passion to understand about the ulnar collateral ligament. And we recognized a decade ago something was going on. And what was that was causing more and more of these athletes to have problems? And although we saw it and it was publicized in professional baseball, we knew it was much more than that. And Brandon started by collecting as much of the public data available before we were part of the research committee, and started looking at this in a variety of different ways and seeing how the return back to sport and how things were doing. And Pete Chalmers helped us out a lot, and supposedly with statistics. And Nick Verma, who's now the head team physician for the White Sox, was involved in that too. And we wanted to answer a bunch of the questions that I'll just briefly go over. And that is, what group of athletes have this problem? What are the trends? What can we predict who's going to get this? And then what are the things we can do to possibly prevent that? So is there an epidemic? It depends on how you think about it. I think at this point, it's almost expected. An epidemic would be that you'd see this incredible increase. And I think that happened a decade ago, but I think we've sort of settled into this is where we're at. And we used a Pearl Diver database, which is an insurance database, to get a feel for what's going on in the community. And what we found is that it was really remarkable. The highest incidence and the fastest growing number of UCL reconstructions was in the 15 to 19-year-old age group. And it was very impressive. It was 10% increase per year over a decade. So that's pretty impressive when you see that spike like that. And that's over half of all the people that are getting the surgery, these younger kids. So certainly the Sentinel event is what happens in Major League Baseball, but this was going on at a younger age. And maybe some of us was related to the point that Chris brought out, and that is that people just said, well, it doesn't matter if you hurt your elbow, you just have reconstruction, you'll actually be better. And there's still a lot of people that believe these kind of things. And Chris's paper on that, the public perceptions of Tommy John surgery, really, we see this and deal with this with our athletes in the office on a regular basis. Now, this is a study about more recent prevalence of ulnar collateral ligament injuries in professional baseball players. And again, it's very clear there's been a significant increase over the period of time that this was done. And you can see going from the 2012 to 2018 what's happened. Why is that happening? Why are we seeing so much more at this level? And then this most recent report was done with a database that's sort of a proprietary database that's at HSS, but it has some de-identified records for over 230 million patients. And again, it shows you just some seasonal and monthly trends. Most of these things are happening at the early part of the baseball season, and then it tails off towards the end of the year. So what causes this? Well, there's a lot of risk factors, and there's a lot of papers that have given one after another, but probably over and over again, the one that's going to stick out is pitching with higher velocity. Velo is driving this. So we looked at this, others have too. Fast pitch velocity predicts UCL reconstruction in Major League Baseball pitchers. And if you look at peak velocity, so when I hear of some guy coming out of college, he throws 100 all the time, I'm just a matter of time before his UCL reconstructed. That's what you think about. It's not always true, but that's what you kind of suspect is much higher risk if they're just throwing hard all the time. In our young kids, it's the same. As they get older and go through their age, their velocity goes up and up. This is just average. And then with pitch velocity comes increasing injury. And with our pitchers at older ages and professional, again, it's the same thing. The faster they throw, the higher risk of injury. Here is a bunch of the teams, and this is the average speed of the baseball fast pitch in 2010, and here it is in 2019. Average. It's gone up substantially. So fastball velocity is increasing. Here is the percentage of fastballs. It's gone down. So it's decreasing. So it's probably not just the workload. It has to do with the velocity. There's a lot of evidence to suggest that. There's other things that play a role. This is for some of our younger kids. Curveballs were associated with a higher risk and also throwing sliders early on. Some of this work that was done a while ago drove the thought process with regards to our Pitch Smart program and when you should start throwing those types of pitches. It was also seen that the number of pitches thrown per game and thrown per season made a difference. And that ended up with Major League Baseball supporting this program. And they have all the guidelines available for the youth pitchers on there, which I often refer my younger patients and families to that. When you look at the history of injury in youth and adolescents and what's going on, you can look at a variety of different things. We had trouble correlating it to the pitch type. Some of these kids weren't throwing that many breaking balls, but what we saw, again, velocity was number one, but also kids that go through a height change in a quick, like 10 inches in a year or two, they're creating a lot more torque on their elbow in a short period of time. That's another risk, and pitching for more than one team. There was a lot of talk that who knows if pitch counts really make a difference or not. And I was sitting next to Dr. Andrews, and Michael Axe was there, and they said, you know, we should really look at this from the League World Series. I mean, if we really kept these kids on pitch counts, would that make a difference? And so I called Brandon and said, hey, Brandon, can you help me out with this project? Because Brandon's really good at this stuff. And so we did. And so we looked at youth pitchers. We followed them from the League World Series. This is a really good paper to have in your back of your mind when you're talking to parents when they're 12 and 13-year-olds sitting in front of them. They're going to be the next Cy Young Award winner, and just give them some odds of how that's all going to work out for them. So among these pitchers, you can see it's not going to be very dramatic here. But again, those who went on to pitch professionally, the numbers are really, really small, 5%. Number of pitchers who had a UCL, 2%. And then the pitchers who pitched in the minors, a little bit higher. But you have to tell these parents that they should make sure their kids are playing in more than one sport. Don't bet on baseball all the way through. The other thing that's important is when you look at this carefully and you say, okay, percentage of progressive professional play and violated the pitch count, 50% of them had a UCL reconstruction. Those that progressed professional play and adhered to the pitch count, only 2 had a UCL reconstruction. So maybe it's not causation, but very, very strong evidence to suggest pitch counts make a difference. Here's another way to look at it. History of pitch counts leads to injury. If you look at the pitches per game and the pitches per year and you plot that all out, only 10 more pitches per game or 500 pitches per year causes a statistically significant increase in the injury of the elbow. Pitch counts make a difference and can help the kids get to a higher level. We also have looked at other things, and others have too. This study is being redone. We saw that pitchers that pitch in a warmer area had a higher incidence, probably because they were doing it year-round. Now with all of the sports complexes are available year-round, this may not fit anymore. So we'll redo this study almost a decade later, see if it makes a difference. But it did make a difference back then, and you could see that. Kevin doesn't believe it fits anymore. He says they're coming from everywhere now. How many innings should we throw? Is workload the answer? It probably is. We just haven't had a really good way to look at it. So we look for average counts per game, cumulative pitch counts, innings pitch, everything. And we really could not find, at least in the evidence that was available a few years ago, an association between cumulative pitches, starts, innings pitch, or average pitches per start being placed on the DL. And I know that flies in the face of what people think, but at least the evidence wasn't there to say you have this many pitches in that pitching arm during your lifetime. You better just be careful how you use it. I think that's the way some of the agents think about it. They don't want to overtax their athletes early. They'd like them to have paced it through the program, so they're going to have long-standing careers. But we also have to keep in mind there's a lot of pitches that don't just happen from the pitcher's mound. So that's some of the things that we know. Velocity is still the biggest thing. If we know that, can we actually prevent it? Can we identify the at-risk players? And you've already heard from yesterday and from today. Most of the way to identify the at-risk pitchers is look at the shoulder. And when you look at people that have had Tommy John surgery and their career is over, what's the number one reason their career is over? It's not their elbow, it's their shoulder. So this is a very important point to keep bringing up. Here's a study looking at glenohumeral range of motion. Kevin can talk about this later, but basically GERD has been the big talk, and we've had some discussions, so I won't go through it again, but really total arc of motion is probably a better way to look at this as predicting who's going to get injured, and that certainly was shown in their large study. There is some controversy here. This is Ellen Shanley's work, and Kevin can speak to this, and I'm not going to go over it, but again, I think the important point is that you have an asymmetry to movement. If you have a stiffness in the shoulder, as Keith brought up today, that's just not right, you're increasing the forces on the elbow in an abnormal way, and you're going to increase your risk of injury. And that shows up over and over again in the work that's out there. So even a greater than 5-degree rotation difference or flexion difference can increase your risk more than 2.5 times for injury. Again, another study that was done more recently, 28 pitchers from 3 collegiate baseball teams, and you look at the bottom again, each degree of external rotation resulted in increased elbow torque. And so again, we have to keep in mind our pitch counts and for our little kids and how we're going to prevent this injury. And limiting pitch counts can decrease elbow pain, as we showed, as well as has been seen by our Japanese colleagues. And this is a study where they had statistical significance, and I already told you about what we found with Little League World Series. Keep in mind that it's remarkable, but using the HITS database, the risk of non-game injuries in pitchers is even higher than game injuries. And so that might be another area where we have to pay attention to make sure that we're reducing the risk of injury that takes them out of their sport. But when you look at all this data, in fact, it's really remarkable that you can see that throwing results in injuries, but not as much as non-game injuries in our pitchers. And so we have to keep that in mind as we're trying to figure out what to do. And can we predict it? If we're seeing some of the problem, we did this study where we looked at adolescent male pitchers and we put them through a simulated game and saw how they throw. And what we found is that as they started to change their core, they started fatigue, they would increase the risk of placing their arms in a bad position or open up their hips early. And so the hip to shoulder separation increased with increasing pitches, as we know, and as they lost their form, they were putting their arms in a provocative position, and others have showed the same thing. And so this could be a way, if we see an athlete that's starting to lose their pitching mechanism, we can recognize that, like our high-level pitching coaches do at the major league level. We should be taking them out, even if they're still performing well, to prevent them from having an injury. This was a paper, one couple last things where we got in a little bit of a tussle with, and you know that some pitchers have been restricted in how many innings they can pitch after they come back from UCL reconstruction. I just wanted to know if there was any evidence for why it was only 150 innings or 160 innings. I mean, how did they come up with this number? And again, Brandon helped out with this, and we went through literature and we set thresholds. You know, is it 150? Is it 170? Is it 180? We could not find any evidence to suggest that restricting the innings after you come back from UCL reconstruction changed the risk of you having a revision UCL tear. Some people still believe it, so there's probably another way to look at this in terms of workload. And what we think probably what you need to look at is what they did before their injury, and then keep them sort of on track for that or below that after their injury, let them build back up. But that's speculative. We don't have any evidence that's really what it is. And then Chris has showed us that if you have someone who's having flexor forearm problems, you need to take that seriously, because they're at a high risk of going on to have a UCL tear in the near future. So this is another area where we can say, can we prevent it? Yes. If they're having flexor injuries, you need to treat that seriously. You need to be careful with them because they're putting a lot of stress on their UCL. So with that in mind, we're going to hear what to do now. But remember, this remains a major source of morbidity for all baseball players at all levels. Velocity is driving this increased incidence of this injury, and we have some new ways to treat this, which may help us get our athletes back on the field, but we have to continue to think about how we can prevent this injury. So workload's going to be important, maybe some type of enhanced recovery. You heard some ideas about injecting biologics at the end of the season and someone's had some problems. And then what else we can do to try to figure out if they've recovered from their problems before they go back to pitching at full speed. Thank you very much.